It's time for Kadlec on Call on News Radio 610 KONA. It's your chance to learn valuable health information right here in our community. Now, the host of Kadlec on Call, here's Jim Hall.
And a good Wednesday evening, everyone. Welcome to another edition of Kadlec on Call. Wednesday evenings from 6 to 7, we come your way and talk about a particular health or medical topic. And tonight, we're going to dig into Parkinson's disease and what causes it. And we're going to visit with some people who are coping with having Parkinson's disease. And most importantly tonight, we're going to talk about some incredible therapy services that are available here in the Tri-Cities for people who are dealing with Parkinson's disease and how they are coping and in many ways thriving in spite of what they have. And so a lot of ground to cover on this important topic tonight. And we're going to introduce our guests. We have 4 of them. We got a packed studio here tonight because we got a lot of different angles that we want to come your way with us. We have Jenny Davis, who is a speech pathologist at Kadlec Regional Medical Center. Laura Molu, who's a physical therapist at Kadlec. Kent Tucker is a patient, Parkinson's patient, who has gone both through physical therapy and speech therapy, and I'm guessing some occupational therapy as well. And Lisa Broderick, who is the therapy services supervisor at Kadlec Regional Medical Center. And so we're going to come at this in a lot of different ways. But first of all, you guys were telling me about a Parkinson's clinic. And Lisa, why don't you, or Lisa or Laura, you guys take your pick of the microphone and talk to me a little bit about just what you mean by the clinic. It sounds like it covers a variety of different therapies related to what Parkinson's patients need to take part in.
Well, back in 2006, the National Parkinson's Foundation was doing some allied team training for Parkinson's. And so Kadlec sent a team of 5 of us down there to go through a week-long training and just to learn more so that we could better serve patients and their families that are dealing with Parkinson's. And so that kind of was the beginnings of the Parkinson's Clinic. And then with Angela Mahandro and the help with Lisa's been really instrumental in getting a lot of things going as well. We started a clinic, so we have both physical therapy, occupational therapy, and speech therapy that we coordinate evaluations. And then after those evaluations are completed, then we do a team meeting and try to find out what the biggest problems are that we want to tackle, putting the patient, the families in the center of that, and finding out what's important for them.
So then you determine essentially a course of therapy as they move forward, depending upon the severity of the disease and what is impacting a patient. For some, it might be something that another one may be different.
Everybody that is dealing with Parkinson's presents a little differently. And so we try to find out what's going to be most important for them at that time. And then as a team, we try to find out what's going to work for that patient and kind of come up with an individual treatment plan. And then do some baseline measurements. And people sometimes come back maybe on an annual basis so we can kind of keep track of how they're doing.
And Lisa, will that mean that when a patient comes in that they would, if their treatment plan requires a little bit of each, they would get that all in one visit?
We try to coordinate their appointments as best as we can when they're coming in for multiple therapies. Obviously, the evaluation is coordinated. And then going forward, depending on what the patient's primary goal is or the primary area that they're deciding to work on, then we work to coordinate those appointments as well.
And so, again, maybe back up a little bit, and I want to let's introduce Jenny Davis, because not only is she a speech pathologist who works with patients at Kadlec along with Lisa and Laura, but she herself has Parkinson's disease. And why don't you maybe introduce to our listeners, just from your view, how did it come to you, and I guess as you began this journey, if you will, what was that like, and what has that been like?
Well, it was very strange finding myself on the other side of the therapy table after I was diagnosed with Parkinson's. I was diagnosed in 2007, and I started having problems with my voice not long after that. Within 2 years, I'd had some pretty significant decline in my voice. And as a speech pathologist, that was definitely something difficult to deal with. But I sought out therapy, and I myself went through voice therapy. And at the time, I only worked with children. I'd only ever worked with children, and that was professionally what I had planned to do. But after being diagnosed with Parkinson's disease and going through the voice therapy myself, I thought, this is a journey that I'm on, and I might as well make the best of this and see how I can help other people along the way. And I started seeing patients at Kadlec in 2011, providing voice therapy. I myself got certified after having to go through the therapy. I went to the training. Kadlec sent me to be trained to provide the voice therapy for for other Parkinson's patients. And so I still work with children, but I also work with people that are on that journey with Parkinson's disease. And it's truly been wonderful along the way, all the things that I've been able to see with others. And the people that I work with tend to be very inspiring to me. So I think we all benefit.
Wow, that's very impressive. And I have to ask this because you said you work primarily with children, but in working with them and you started to suffer the symptoms, were you almost diagnosing yourself in a little bit at all?
A little bit. I mean, it's kind of like seeing a train coming, but you keep hoping it's a kid with a light on his bicycle, and pretty soon the train's right there.
Wow.
So, in hindsight, after I was diagnosed, in hindsight, I could go back and say, well, yeah, I guess I've known for a while, but you're not looking for it. I was in my early 40s at the time, and it was not something that the doctors were looking at. It couldn't possibly be Parkinson's disease. Well, the truth is that it can be Parkinson's disease. Parkinson's disease can strike when you're much younger. The most famous, of course, would be Michael J. Fox, who was diagnosed in his 20s, which is uncommon, but it does happen. It's typically thought of as a disease for older people, and the risk of it does increase as we age. But there are those in the young onset category. It's just not looked for.
Now, you have been working with voice patients. You call it voice therapy. What happens to the voice? Does the voice go away as a result of the symptoms of Parkinson's?
Parkinson's disease, in a lot of ways, could be thought of as a disease of decreasing amplitude and a disease that impacts your own perception. I had no idea how bad my voice had gotten or how soft my voice was. It took my colleagues to, kind of be truth-talking to me to say, you really need to go in for some therapy, because I was putting in the same effort that I had always been putting in, and I was trying, but I just was not getting as much voice out. And at the time, I didn't know what was happening. I was not familiar with Parkinson's disease at that point as in-depth as I am now, but the Parkinson's disease, it decreases your ability, it decreases your ability to perceive how big your steps are, how much you're moving, how loud your voice is, and you almost have to find your new normal. You have to figure out doing it like you used to do doesn't work anymore. You have to do it differently. It doesn't mean you can't do it. It means you do it differently, and it means putting in some more effort, making your movements big, making your voice loud. And in making your voice loud, you're not yelling. You actually bring it up to a normal, acceptable loudness that you can control. And in making big movements and taking big steps, you're not walking like a giant, but you are walking with those steps that you mean to take. You just have to think big. You have to think loud. You have to think you have to speak with intent. You have to move with power.
And Laura Mulder, on the physical therapy side, is hearing Jenny describe the walking part of the physical side of that. Must be very familiar to you with working with your patients on the physical therapy side of this.
Yeah, some of the first early symptoms that are clinical signs that somebody's got Parkinson's is kind of slower and smaller movements. So somebody might be walking and not swinging their arm quite as much. And I think most of the patients that I've worked with, a lot of times, like Jenny was saying, may not be aware of those changes. They just kind of come on slowly and subtly. But the exciting thing is that the exercises that Jenny and I do and that the patients work hard on really help them to maintain what they have and improve what they have, even though it's a degenerative disease. It's exciting to see that even years later, sometimes people are doing much better than they had when we first saw them like 5-10 years ago.
Well, and we have to take a break now, but when we come back, we're going to introduce you to Kent Tucker, who I think is fitting the mold that Laura just described, both from a physical side and on his voice. And Yeah, this is really a powerful topic. The Parkinson's Clinic at Kadlec Regional Medical Center involves physical, speech, and occupational therapy. A very valuable program, and certainly I'm sure Kent will be able to attest to that on a first-hand basis when we return. The name of the program is Kadlec on Call. We will be back with more in just a moment.
Who's gonna have a friendly smile? Who's gonna show up right in style? Who's gonna go the extra mile?
When I need heating or furnace service, I call my Lennox dealer, Bruce Heating and Air. They're available 24 hours a day, 7 days a week, and they fix all brands. And Bruce Heating and Air certified technicians do not work on commission. No trying to sell you parts you really don't need. So keep calm and call my Lennox dealer, Bruce Heating and Air.
Bruce Heating and Air.
When you're running your own business, you're bound to be busy. Too busy. Too busy worrying about your budget. Too busy scheduling appointments. Too busy to build a website for your business. And because you're too busy, it has to be easy. And that's where Wix.com comes in. With Wix.com, it's easy for you to create your stunning website. Go to Wix.com and create your website today. It's easy and free. That's Wix.com.
The McCurley Integrity dealerships are coming off another record year in both sales and service and are expanding their workforce once again. You have a great opportunity to work for the People's Choice #1 auto dealer in the Tri-Cities and Walla Walla, as voted by our customers. This Sunday and Monday, January 24th and 25th, confidential interviews are being conducted to fill open McCurley sales staff positions. Come to the Courtyard Richland Columbia Point in the Tri-Cities or the Courtyard Marriott on Rose Street in Walla Walla. Sales experience or not, you'll receive training from the area's top management team. You'll work alongside some of the brightest and most experienced people in our industry. McCurley's compensation includes a training salary, medical, dental, and vision benefits, 401k, promotion from within, paid vacation and sick days. Bring your current resume this Sunday and Monday to the Courtyard Marriott in Walla Walla or the Courtyard Richland Columbia Point from 8 a.m. to 7 p.m. You can also download and complete the required application ahead of time at BillMcCurley.com. McCurley dealerships are an equal opportunity employer and a drug-free workplace.
Join us this weekend on Northwestern Outdoors Radio as we wrap up the hunting season by telling you how to score that trophy for the record books. We'll tell you about some late-season hunting opportunities, tell you about a group called the Oregon Hunters Association, and preview the big Pacific Northwest Sportsman Show coming up in Portland in just 2 weeks. Northwestern Outdoors Radio, Saturday mornings at 6 on 610 KONA. Powered locally by Griggs Ace Hardware of the Tri-Cities.
You're listening to Kadlec on Call on 610 KONA. This program provides general information only. Any comments or information presented are strictly for educational purposes. Kadlec and 610 KONA do not endorse any of the suggestions made by the presenter or callers. Now back to Kadlec on Call. Once again, Jim Hall.
And continuing our interesting discussion tonight on Kadlec's Parkinson's Clinic, where patients are able to receive some incredible therapy services, whether it's physical, speech, or occupational therapy. And we've been visiting with Lisa Broderick and Laura Molu and Jenny Davis and the Therapy Services Department at Kadlec. And we also want to introduce tonight Kent Tucker, who was diagnosed with Parkinson's in, I think he told me, 2010. And Laura described in the first segment how the goal is to maintain, but a lot of the patients that they all work with, they've seen in a degenerative disease, maintain is really a victory. And is that kind of how you would describe it, Kent?
Very much so. When I first started, I couldn't even do an exercise for, say, seven seconds. Now I can do it like 20 seconds. And
that's a voice exercise.
A voice exercise, and that's, loud. Where before it was just kind of more of a whisper. It was really scratchy. It didn't have really much of a tone to it. But it has helped me out so much that I'm just overwhelmed. It's I've noticed so much of a difference just to myself, as well as other people that I've talked to that know me. They recognize what this program has done for me, and like I told you, I've talked to my brothers on the phone numerous times, and they can even tell the difference when I talk to them on the phone, that my voice has gotten so much stronger, and you can actually tell what I'm saying, and it's more pronounced, it's louder, it's sharper, and it's like Jenny said, with Parkinson's, you have to kind of go with the flow and just maintain and keep with it, because if you don't maintain the program, you'll lose it. And so it's very important to stay on top of the program and do the exercises and everything they ask you to do. And it doesn't take very long. It doesn't take very much of my time. And so I look forward to doing it every day. And it pays off, believe me.
Now Jenny is the on the voice side of working with Kent, and I know we want to touch on a type of voice therapy that you do called Speak Out. It's the Parkinson's Voice Project, and explain a little bit what that is. It's a series of individual visits, and then you have group sessions where and maybe touch a little bit on these exercises. Or these are actually like if you're a singer, it's the voice exercises for singing, or even, as a broadcaster, Ed Dawson and I, you'd do that before you go on the air. You'd actually warm up your voice. But is that really what you do with these patients?
Well, it's a very specific program. We offer a couple different voice therapy programs. We have therapists that are LSVT certified, which is a specific type of voice therapy, and Speak Out certified. And Speak Out is one that we're using a lot with the patients right now, because there's a little more flexibility in the program, and there's a cognitive component to it that a lot of our patients are concerned about word finding skills and kind of putting their thoughts together. And through the voice therapy program, we're also able to touch on those cognitive skills, which is very beneficial. So the program itself involves generally 12. It can be a little bit less or a little bit more individual therapy sessions for the person with Parkinson's disease. Those sessions have very specific exercises that we do that encourage proper breathing, good loud voice using intent, and that's really a key of the program is speaking with intent. It's not enough just to be loud. I joke around with my patients that I don't want them just being loud. If they go into the library, I don't want them being super loud and then telling the librarian that I told them to do it.
Tell our kids, right?
Right. So, but they need to speak with intention. Use the voice that you intend to use, and in doing that, you can be heard. And through that use of intent, through the Speak Out program, the loudness increases of the voice for the person with Parkinson's, whose voice has gotten softer, and clarity of their speech becomes better. And a huge component is expression, that inflection that we have in our voice. So much of our communication is not dependent on just the words we say. It's dependent on how we say it. It's that inflection is what tells the other person.
So you're actually practicing the inflection,
yes.
So emphasizing words or maybe questions versus answers or declarations or whatever the terminology is.
Right. There's a specific exercise that we do called glides that I tease them. I promise I'm not a choir director, but we're going to seem like we're singing here, because they need to go from a low pitch up, and then hold it for a few seconds and stop, and then go back down the other side. And that can be very difficult. Well, it can be very difficult for many people, but in Parkinson's in particular, that can be a very difficult task. But it's to help keep that pitch change in your voice that gives that richness to when we speak. And we've all heard somebody's lecturing that has a monotone voice, and it is just not easy to listen for a long time. And so through this voice, through Speak Out, we're able to really help people improve the inflection in their voice. Once they finish the individual therapy, we go on. I have a voice therapy group, that meets once a month, and I'm happy that this month we actually were able to start a second group. So now I have 2 times a month. Mm-hmm. People can come twice a month or come to one or the other session. And people that have gone through voice therapy for Parkinson's through an individual program and know the exercises can come and keep maintaining their skills with other people who are working on the same thing. And Kent is actually one of my original members of the group. He's the first person with Parkinson's that I worked with at Kadlec, and he's an original member of my group, and is a wonderful example of maintaining skills and even improving over time in some areas.
Kent, back to you for a question or two. And I have to add that being on a radio show, that's voice therapy, isn't it?
Yes,
you're getting your voice therapy tonight.
Yes, I think it is.
But do you find it, and you touched on it a little bit earlier, that you have to keep practicing and keep doing these drills that Jenny was describing?
Yes, I do. If you don't stay on top of it, it goes away, and quicker than you think.
How long from when you first started doing the voice work that you started noticing a difference?
I started noticing probably within the first 4 or 5 sessions that it was improving.
So what do you measure? You got a little decibel meter or something that you can actually, I would imagine, little tools that you can actually see at what level you're speaking.
Yeah, we have a sound meter that Jenny uses, and it measures the sound that protrudes, and it measures in decibels, and we try to keep our voice at, say, between 80 and 90 decibels. Otherwise, it's hard to hear anybody. And then especially, if you get around any kind of noises or background noise, it's hard for a Parkinson's patient to really know how loud he is and how loud he isn't, because the noise interferes with your speech. And so when you, as a patient, I have to try to maintain at, say, between 80 and 90 decibels. Otherwise, most background noises go right over the top of me.
Give me an idea on how frustrating it had to be. You were telling me a story before we went on the air about just going to order something at a drive-thru at a fast food place.
When I first started out, I was telling Jenny that the most frustrating thing for me is when I went to a drive-in to order some food, they couldn't hear me, and I would yell at the top of my voice, and I thought I was loud enough, but I wasn't, and it was just really frustrating for me. Finally, they would just get kind of discouraged with me and say, "Well, go ahead and move up to the window." And
you laugh, but it had to be very frustrating and probably discouraging.
It was really discouraging for me and frustrating. And so I'd go up to the window, and a lot of times they still couldn't hear me. I had to shut the engine off, and that's how bad it was. And now it's...
You go through the drive-thru with pride now.
Yes. Yes.
We laugh, but that has, what an accomplishment.
And I don't get frustrated.
Yes.
Believe me, unless a person goes through something like that, it's not very pleasant.
So you like to hear yourself talk, is what you're telling me.
Yes.
That's really cool.
Yes.
This is Kent Tucker, and he was diagnosed with Parkinson's disease in 2010, and you can tell if you could see him. Unfortunately, you can't on the radio, but he looks great. He sounds great, and what a great story to hear his story. And Jenny Davis, who is the speech pathologist, who is also a Parkinson's patient. And we're going to continue this discussion because we have a lot more to get to on the entirety of this program of what's available for Parkinson's patients here in the Tri-Cities. Back with more of Kadlec on Call in just a minute.
You're listening to Kadlec on Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Kadlec on Call. Here again, Jim Hall.
And continuing the discussion tonight on the Parkinson's Clinic at Kadlec Regional Medical Center, a comprehensive therapy services program for patients who are impacted by Parkinson's disease, and a very inspirational discussion tonight with all of our guests: Jenny Davis, a speech pathologist; Laura Molu, a physical therapist; Kent Tucker, who's a patient with Parkinson's disease; Lisa Broderick, therapy services supervisor at Kadlec. And we've touched a little bit on the voice side of how Parkinson's can impact patients, and Jenny and Kent have both addressed their particular firsthand concerns of being Parkinson's patients and having to work on this on a regular basis. And we've also touched a little bit with Kent on the physical therapy side of what he's had to deal with his diagnosis. And Laura, talk a little bit about, Laura Molu is a physical therapist, the work that you do with patients on the physical therapy side. What kinds of things do you need to do, and do they need to do to help them be able to, as you call it, maintain?
There's some really good evidence-based exercise programs that we try to teach people that they can do at home, so they can continue, just like with the voice therapy, be proactive and kind of empower themselves to maintain what they're able to do. So we do LSVT Big or Power Moves are two different programs that we train them. But specifically, when we look at their ability to get in and out of bed, in and out of a chair, on and off the floor, how we look at how well they're able to walk. And turn, go up and down stairs. Occupational therapy will also help a lot with activities of daily living. And sometimes a tremor is common with Parkinson's, and that can impact the people's ability to eat and feed themselves, get the food to their mouth. It's difficult. Writing is impacted frequently, too. The occupational therapy also can do driving evals, or both physical therapy and occupational therapy do home evals, so we can kind of assess the safety in the home and make recommendations for people.
And I'm going to go back to Kent and Jenny, too. Jenny's the speech pathologist, but she's also a Parkinson's patient herself. And Kent Tucker, back to you before we go to Jenny, but talk about that physical therapy side. I think Laura was talking about the tremors and just the challenges of getting up out of a chair, getting out of bed in the morning. Is that something you had to cope with and overcome?
Yes, I did. Not quite so much, but I sometimes it's a challenge to get out of bed in the morning. Once I get out of bed, sometimes I will freeze, and it takes me a couple of minutes before I can actually get up and move. It's something that Parkinson's patients do. Not everybody is the same. Everybody's different. But for me, myself, that was mostly where I have a problem with, and it's called gait. I do freeze up even once in a while trying to get up out of a chair. But so it happens to me quite frequently in that respect. Mainly, like I say, getting out of a chair or out of bed. Some people have a problem with even starting to walk. When they go to walk, they'll just freeze right in place and they can't get going. And that's a part of Parkinson's. It's just the way it works.
And Jenny Davis, with your symptoms that you deal with, and when you're in your expertise on the voice side of the speech therapy with patients like yourself and Kent, but on the physical side, did you have that same thing? And it's a constant where you're as Laura said, you're just like you're practicing the voice lessons, you're also doing the same on the physical side.
I joke around that it helps a lot that I'm surrounded by physical therapists every day at work. That helps me remember what to do. But I do find that I have to think a lot about, stand up straight, knees over hips, or shoulders over my hips, over my knees, take a big step. I tend to tap doors as I go through. I'll reach out and touch the door frame as I step through, which I step through doors probably 100 times a day at work, it seems. And pretty much every time I go through, I'm touching the door jamb as I go through. And that's a cue that works for me, so I don't hesitate as I go through the door. Mm-hmm. Now I'm giving away my secrets to my coworkers here. And just things like posture and size of my steps. And sometimes I notice more difficulty than others, but I try to keep up on my exercises and work at it. And it's something that, as a person with Parkinson's, I feel like I can do something about.
Well, I have to say, and a question that we have in an area that we haven't touched on is both you and Kent have incredible attitudes. And I would assume, and I would think that has to be, especially for all of you that on the caregiving side, has to be a critical component. And is that something both that is critical for both of you? Start with you, Jenny, and then move back to Kent.
Yes, absolutely. I think it's easy to get frustrated with yourself. It's easy to stare in the face of something like Parkinson's disease and get discouraged very quickly. Some days are more difficult than others, but attitude makes a big difference. And it's part of what I have appreciated as a patient, as far as the therapies go, is that Parkinson's disease does not just have to happen to me. It happens to be something that I have, but it's something that I can deal with on a day-to-day basis. And sometimes it means I do something different. Sometimes it means, if something is getting difficult to do, then I try to do it more. I'll still hike up Badger Mountain now and then, not as often as my husband, but I have been known to hike up there. And I keep active, and that helps with attitude also. Having a good attitude helps you manage your disease, and managing your disease helps you keep active and keep that good attitude going. And it really is critical.
Has it made you a better speech therapist, speech pathologist?
I like to think that it has. I don't know how it couldn't, in that I have worked with, like Kent and so many other Parkinson's patients that I've worked with. It changed my course professionally in a lot of ways to an area that I never anticipated working. I had never anticipated working with adults. And it's opened up a whole different area for me professionally that has enriched me, not just professionally, but also personally. I've gotten to know some incredible people, including Kent. And I say anytime I give a talk anywhere, I say, how could I not love my job? It goes with working with the kids also, but working with adults, I get to be an integral part of helping people maintain their ability to communicate, which is so important in our lives. How could I not love doing that? And the people I work with help me keep a good attitude, because I see how hard people like Kent and my other patients work, and that helps me. So I like to think that we're kind of all in this together.
Kent, I guess you could call her your boss on the voice side of things. But to hear her talk, I mean, you must draw inspiration from someone like Jenny, who is in the same situation that you are, but yet she is an expert in what you can now do when you can go order your food at the drive-in.
Well, that's one thing, too. I admire Jenny because she has had to cope with everything I have, and she's come a long way herself. And also, it's like she said, when you get first diagnosed with Parkinson's, it kind of hits you like a ton of brick. You don't know really what to think about it, but some people probably take it in a different way. But I thought, well, it's something that I can deal with. I'm just going to have to make the best of it and deal with it the best way I can. And as long as I, take my medication and keep my exercises going and keep one foot forward all the time, I'll be okay. And so far, it's paid off. I haven't declined. As far as my Parkinson's, it seems to be maintaining about where it was, except it's like Laura said. I'm sure she even can notice the difference when I first met her. It's amazing. And a person that has Parkinson's, you have to work on it, and you have to have a positive attitude. I think that's very important, because if you don't, I just don't know how a person would cope with it. It takes a lot of work, and you have to, like Jenny says, you have to override everything that you do, because just a regular person, they can talk and walk and chew gum or whatever they want to do, and they don't have any problems. But for a Parkinson patient, you have balance problems, you have all kinds of issues that you have to overcome and compensate, where other regular people don't have to do that. And so it really helps to have a positive attitude and just try to stay on top of everything, because, like I said before, it does pay off.
Well, you're paying off tonight for people in your who are suffering from Parkinson's. I just can't say enough how much it means to us to have you be willing to share your story, because it truly is inspirational. We have to take one more break. When we come back, some concluding thoughts on all this great work that's being done in the Tri-Cities to take care of Parkinson's disease here in our community. Back with our final segment of Kadlec on Call in just a minute.
You're listening to Kadlec on Call on 610 KONA. This program provides general information only. Any comments or information presented are strictly for educational purposes. Kadlec and 610 KONA do not endorse any of the suggestions made by the presenter or callers. Now back to Kadlec on Call. Once again, Jim Hall.
And just a few minutes left talking about the Parkinson's Clinic available at Kadlec Regional Medical Center, and also all of those services are housed within the beautiful Kadlec Healthplex located on Lee Boulevard in Richland. There's plenty of parking in front of there, and it's just these are just a few of the many, many vital services that are provided to members of our community. And on the Parkinson's Clinic side, we've touched on the physical, speech, and occupational therapy services available. And we also want to make you aware, and we've featured this organization on our program, and it's really closely connected with our topic tonight, and that's Kadlec Neurological Resource Center. And they have an incredible library. They have tremendous support groups for Parkinson's and other neurological impacted patients and their caregivers. And in fact, the Parkinson's support group meets at 1:30 on the third Monday of each month at the Kadlec Healthplex, and that's available to anyone who would like to come and attend, patients and caregivers alike. And it's incredible some of the things that they do. We touched on the resource library that they have. They also, I'm told, have a supper club, and this is for patients. We've heard both Jenny and Kent talk about regaining their voices from Parkinson's disease. And the supper club, they purposely, I'm told, go out to restaurants that are loud so that they're forced to converse in a way that they're using their new voices, or their renewed voices, if you will. So I just have a couple of more questions before we leave the air, and I want to focus with Kent and Jenny, because to hear both of them talk, Jenny both as a Parkinson's sufferer and a speech pathologist, and Kent, of course, who he has become the ambassador, I think, of the program just literally right now. But I just want you both to maybe give our listeners some parting advice, maybe some takeaway messages, because, there might be someone out there listening tonight who maybe in the early stages of something like this and they don't even know it, or they may have a caregiver. Why don't we start with you, Kent, and we'll wrap with Jenny.
There's a lot of people out there that. Oh,
go ahead. I'll just jump in because I just hesitate to make you stop talking.
Okay. A lot of people out there that have Parkinson's, they really don't know where to begin or where to start, and their caregivers are totally lost also. And that's kind of where we started out. We didn't know where to turn to or anything, so our doctor recommended the Resource Center, and we went over there and got some information, and a lot of it is free to take. You just go over there and pick it up, but they have books, all kinds of books and literature you can, and tapes, DVDs that you can rent, books you can rent, all kinds of information that is just unbelievable and very helpful. Besides all the other activities we have as far as going to the supper club like that and to our monthly meetings where everybody has questions that has Parkinson's. We get all kinds of information from everybody that's gone to different doctors and so on. So it's very helpful.
Well, I want to just say thank you. I'm going to give you about 10 seconds, 15 seconds, Jenny, if you could, just to maybe tie this all together for us. I know that's not a lot of time, but
that's okay.
Please do.
Just if you have Parkinson's disease, or if you care about somebody who has Parkinson's disease, don't be afraid to reach out and get some help. The Kadlec Neurological Resource Center is a wonderful resource. We have fabulous therapies that are available. You can do something about this. Attitude matters. Get on top of it. Be part of your treatment and be a member of your own team, and you can do a lot.
All I can say is thank you both, and thank you to Lisa and to Laura, and especially to Jenny and to Kent. Very inspirational and very motivating, and we'll have to make this program available for people if they want to check it out, because now you're famous, Kent. Again, thanks to our guests, and thank you for listening to Kadlec on Call. Have a great week, and we'll see you next Wednesday night.